Good evening. I'm Sherry Shelton, and I wanted to go over my organizational structure PowerPoint tonight. I wanted to discuss Baylor All Saints Medical Center, Scott and White in Fort Worth, Texas. It is an acute care facility that has 574 beds. It is a decentralized organization that uses shared governance as their model, and it is a not for profit facility located in Fort Worth, Texas. The mission statement exists to serve all people by providing personalized health care and wellness through exemplary care, education, and research as a Christian ministry of healing. The vision is to be the most trusted name in giving and receiving safe, quality, and compassionate health care. This facility also has a micro system, which would include it's a small group of professionals that work together regularly to provide care. It would include your ER, ICU, endoscopy, day surgery, radiation, nurses, doctors, dialysis. The macro system would be your data collection, insurance plans, and spending. The chain of command would include the nurse or staff member. If you could not solve a problem, you would go to your supervisor next. If the supervisor is not able to resolve the issue, you would go up to your manager. And then from there, if there was still an issue, you would use the director of the department. And the last person would be your CNO, which is your chief nursing officer. The chain of command establishes accountability, and it explains the hospital's lines of authority and decision-making power. The administrative leadership style that we have at Baylor Scott and White is a shared leadership style. The CNO is a transformational leader that asks for others' ideas. She notifies the staff of all the changes that will occur. And the chain of command for a mass casualty event, the disaster plan dictates how decisions will get made. It is a system-wide decision-making process that uses state codes and takes direction from the CDC, which is a federal agency. We use at our hospital a shared governance, and the shared governance believes that nurses best determine their practice and allows the staff control over the major decisions about their practice and the decisions being made by consensus. We have a nurse and doctor system that round and discuss the patient's care with the patient and family involved at the bedside. This improves communication, decreases medical errors, and also improves the patient outcome. And conflict management, like I said before, resolution needs to take place between the two staff. And if that's not resolved, then you would want to use your chain of command if further help is needed. Patient family concerns, you want to allow that patient and family to verbalize their concerns and complaints. Listen to them without interrupting or arguing with them. If you're not able to offer help, then you would get your supervisor involved. You could enter something into MIDAS. We also have at our hospital a patient family care advocate that would help the patient and family with any complaints or problems that they have to try to get these resolved. We want to follow up with the patient and with good communication and follow up with any updates. Also, the chain of command in a mass casualty event. Each community and hospital develops their own local emergency or disaster plan. It needs to be coordinated with the regional and national level plans. The basic components of this chain of command in a mass casualty event would include your analysis of the situation, your goals, your objectives, the site organization, your roles and responsibilities. So the roles and responsibilities would discuss who does what, when, how, and with what. And then you want to also include coordination. So the management system needs to include like a command post. You would have a command post set up, an advanced medical post, evacuation and transport plan, hospital care, and you would want it to be activated in a coordinated manner. The agencies with resources that are allowed to assist and offer care would be FEMA, the CDC, the Red Cross, and then your state's Homeland Security officer. So when you're talking about the structure in a mass casualty event, you would want the incident coordinator at the top of the pyramid, and then underneath you have 3 levels: the public information officer, the safety officer, and the medical officer. So also you want to know your triage categories. Black means that they're not likely to survive or that they're already dead. Red is going to be your highest priority need. They need immediate care, usually within the first 60 minutes, to increase their chance of survival. The next color is yellow, and they may have a serious or life-threatening event, but transport could be delayed a little bit. They're going to follow under the red. The green is going to include just minor injuries, and they can wait. Sometimes they can be treated at the scene and released. So communication and having a plan in place makes this more successful. And how the nurse would be affected in this is that you may be required to go to another department and help, but it would only be what you're trained in and what you feel safe in. So if you have your basic life support or advanced cardiac ACLS, then you might have to go and help in those areas. But if you did not have experience in those, then they would put you in a level where you feel safe. So the thing is, you may be called in to assist others using your nursing skills and knowledge to the best, and you may stay longer hours and have to help in any way possible to make the outcome better and to provide safety for each patient, because that is a priority, is safety. And you always want to start with the young children, underaged children, because they will need care way beyond and far more than what an adult would, because of their system and the way that they're made. So it's great to plan these things and go through your emergency plan, so in case a mass casualty event does occur, that you are prepared and you know what to do. You don't want to wait to the last minute and then be worried about not knowing what to do, where to go, and how to help. So thank you, and have a good evening.